Congratulations, you've retired. What that means is you have no more work insurance, unfortunately, and you gotta go and figure out what to do on Medicare. Now, Medicare is the same and different in a lot of ways in form of insurance and how insurance works. When you go into the Medicare program, you actually have an opportunity that you've never had before. And that is, you can get into a program that is not governed by greedy insurance companies. Now, more on that a little bit later. But in this video, I kind of want to give you the two ways that you can get Medicare and how they are vastly different and how really just trying something out may not be in your best interest. Get right into it. So there are two ways to get Medicare. And remember I said in Medicare, you have the once really in a lifetime to get on this wonderful program where you don't have to be governed by insurance companies. And the way you do that is by being on the original Medicare program. Medicare Parts A and Parts B are insurance, but they're not insurance in the private insurance sense. They're more like social insurance, where the government has a pool of money and you're entitled to services that are covered under the Medicare program. The way you get these services is through a Medicare license or Medicare approved physician. And that physician knows the guidelines, and so long as that physician prescribes to you or orders for you a test, a service, a prescription, then in that physician's office or in the hospital, you will get those services. Unlike at the group insurance level, where if we were on a group insurance program, we would first have to go through the insurance company. After the doctor ordered the service, prescribed some medication, we would have to wait for the insurance company's decision. Under the Part A and B of Medicare, we would not have to wait for a decision in most cases. There are certain things that require a prior authorization on Medicare Parts A and B, but definitely not nearly as many services as on the group plan that you have at work. So you have this wonderful opportunity to join a real health system that is governed and guided by your physician and your choices versus your physician, your choices, and ultimately the payer or the group insurance plan. Now here on the Medicare Part A and B side, there are problems. When you get services under Part A and Part B, they can be very costly. An admission to the hospital under Medicare Part A is $1,556 as of 2022. Medicare Part B, which is outpatient doctor services, outpatient surgery, emergency room, those services after a $233 annual deductible are 20%. So if you've ever seen an ER bill for the emergency room, imagine paying 20% of that. That is primarily what it could cost you. Also, a lot of surgeries have been moved from the inpatient hospital system to an outpatient setting. You can now get knee surgery in and out. Many chemotherapy or cancer treatments, those infusion centers, are covered under Part B. So you would then be responsible for 20% of that visit up to an unlimited amount. Unlike before, when you're on the group insurance, we had something called a maximum out of pocket. Under the original Part A and B program, we don't have that maximum out of pocket. Now, what can you do instead? There's gotta be something, right? And there is. And that's called a Medigap plan. Medigap plans are offered federally, standardized across the US. As you can see here on this chart, these are the different standardized letters. And the percentage next to it shows you how much of the financial cost the plans cover. I only talk about two plans, Plan G and Plan N, and for those of you still eligible, Plan F. But this is how we would cover that financial responsibility that we have by wanting and by preserving the freedom and flexibility of the original Medicare program. What about group insurance? I'm so familiar with working with my insurance company anyway. And I kind of like having all these extra things in it. Well, that's fine. That's great. But I don't want you to forget and to overlook the power of freedom and flexibility of choice. Now, under the Medicare Advantage side, and that's where we would take our Part A and B benefits, and we would then give them to the insurance company to help manage our Medicare needs. For those people, Medicare Part C can be very advantageous because it offers more things like gym membership, sometimes dental. Now, these benefits, if used to help preserve our health and to keep us healthy, can be very useful. Unfortunately, though, many Medicare Advantage plans do not cover well. And again, I'm not a doctor. I just know from experience, from helping people, that many times these Medicare Advantage plans will deny services. And from this report, the Office of Inspector General, Medicare Advantage plans actually deny a lot of services for no apparent reason. And normally, these services would not have been denied under the original Medicare program. Now, whether or not these services were necessary, I mean, to be honest, I would think they were if a doctor ordered them for a patient who required this service. But then I can't say because it's not my situation. But if you want to avoid any kind of mix-up or claims issues or billing issues, then sometimes this route is going to hurt you. Also, another thing that having a Medicare Advantage plan kind of hinders you at is if you pick one that is an HMO. So HMO plans typically will have a lot more benefits, a lot more bang for your buck, so to speak. But if you receive care from a physician who is outside of the network, you're actually responsible for all of that cost, even though that hospital or that provider accepts original Medicare. You will still be billed for 100% of that service. Now, on the original Medicare program with Part A and Part B, you can see any provider across the US that accepts Medicare. You can go to any hospital across the US that accepts Medicare. And that is another benefit, and I believe a true benefit of the original Medicare program, where instead of having to, number one, figure out if they're in a network of the private insurance plan, and number two, make sure that that private insurance plan is going to authorize that service, it's something that you don't really have to worry about under original Medicare Parts A and B. So long as the doctor orders it and the hospital accepts original Medicare, which is most of the hospitals across the US, you'll be able to get that service so long as you can get an appointment. Another hindrance for Medicare Advantage is the prior authorization process. Many times, I myself have been accustomed to this, I required an MRI, but the insurance company would not pay for an MRI until my doctor did his best due diligence to tell them why I need an MRI. And I had to wait 6 months for an approval before they would do an MRI on my brain. And while yes, I'm still here, it's great, but I had to wait 6 months for approval. If I would have been able to join the Medicare program, there would be no approval process, because so long as the doctor said that I meet criteria to get this brain MRI, that's a Medicare covered service, I'd be in for the next appointment. But unfortunately, I still am stuck with group insurance. So that was my, I guess you could say, my path. For those of you who have a choice, this path, the Medicare Supplement with Medicare Part A and B, that's an option. It's not an option for me. You might be saying, well, Matt, I'm part of a PPO. PPO is Preferred Provider Organization. I can go to any physician that accepts Medicare but I get a better rate when I see the ones that do accept this plan. That's true. But the caveat is that whenever you see a provider who's not in the plan but accepts Medicare, that provider has a choice to see you, and that provider has to accept the terms and agreements that the plan, your private plan, sets forth for him or her. Meaning that whatever medical charting that the plan requires to get reimbursed, they have to comply, and they have to know exactly which plan you're on and what those guidelines are. So for the most part, and I have no experience with this at all, but I do know when you're getting care from someone who's out of the network, you don't want to have more friction than less. So even though PPOs do offer that flexibility, so to speak, I don't know how valuable that actually is. And for preferred provider organizations, many times you are going to be stuck with whoever's in the network. The only saving grace is that you won't need to get that referral. And with that referral, which most doctors will require anyway, the only difference is you don't have to get that referral approved. So for preferred provider organizations, I do prefer them over HMOs, because with HMOs, if you don't get a referral approved, you have to pay 100% of the cost, even though they were in network. With a PPO, you don't have to get that referral approved. Now with the original Medicare Part A and B, the provider might require a referral, but the provider does not have to get any approval to see you. And unlike a PPO, where you have to ask that Medicare provider who's out of the network if they will see you and accept your plan's terms and agreements as far as reimbursement and whatever guidelines they need to follow, you can just go to that provider anywhere in the US and get care. Now there is one other thing that you have to kind of think about when you do run the Medicare program. Both of these things we talked about now only cover medical services. Medicare Part A and Part B services. These are services offered by the hospital, skilled nursing home, doctor's offices, physical therapist offices, emergency rooms. I have yet to talk about drugs that you buy from the pharmacy and take home. Medicare Part D. I have another video you can watch right here that goes over what I call pharmacy insurance and how pharmacy insurance works and how it's a little bit different from Medicare Part A and B. And even though it is part of C sometimes, you need to think about it in a completely different subset because of all the ways that it functions. All right, we'll see you in that video. Have a great day, and again, congratulations on retiring.